Hello, everyone. Hello. Happy Tuesday. Happy pre Thanksgiving to everyone. I'm going to give everybody a few seconds to get connected, get logged on. Hello. Hello. All right. My name is Phyllis, and welcome to Florida Training. Today we are talking about end of life care, and it's going to be a practice test as well. All right, let's go ahead and get started. End of life care practice test. Hospice and palliative care are essential components of compassionate healthcare, focusing on improving the quality of life for patients facing life-limiting illness, their families. As a CNA, certified nursing assistant, a home health aide, HHA, understanding the philosophy behind hospice and palliative care is vital to providing hospice patient centered support. This approach prioritizes comfort, dignity, and emotional well being while addressing physical, psychological, and spiritual needs. By gaining a deeper understanding of these principles, CNAs and HHAs can enhance their ability to deliver empathetic care, effectively communicate with families, and become invaluable members of the healthcare team in this specialized area. Let's get ready to engage and learn more about hospice and palliative care. Don't forget to like, share, and subscribe to our channel. Mhm. First, first question: what is the primary goal of hospice care? A, to cure the illness. B, to provide comfort and manage symptoms. C, to extend the patient's life at all costs. D, to prevent the patient from dying. Drop your answers in the chat. Drop your answers in the chat. A, B, C, or D. What is the primary goal of hospice care? All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. The goal of hospice care is to provide comfort and manage symptoms when a cure is no longer possible, focusing on the quality of life rather than extending it. A, do not resuscitate DNR order means that A, the patient does not want to receive any treatment. B, the patient refuses all forms of medical care. C, CPR should not be performed if the patient heart stops. D, the patient cannot be moved to ICU. Drop your answers in the chat and let me know what you think it is. A, B, C, or D. All right, I see a lot of C's. Let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. A DNR order means that cardiopulmonary resuscitation (CPR) should not be performed if the patient's heart or breathing stops. but the patient may still receive other forms of care. What is the best way to support a family during their loved one's dying process? A. Encourage them to leave the room. B. Give them space by not engaging with them. C. Avoid discussing the patient's condition. D. Offer emotional support and allow them to express their feelings. Drop your answers in the chat and let me know what you think it is. All right, I see a lot of D's. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Offering emotional support and listening to the family's concerns can help them cope with the situation and process their grief. What sound might be heard during the death rattle in a patient nearing the end of life? A. Low gurgling or rattling noise. B. High pitched whistle. C. Deep sighing. C. Deep sighing. D. Soft humming. A, B, C, or D. Drop your answers in the chat. Drop your answers in the chat. Drop your answers in the chat and let me know what you think it is. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. The death rattle is a gurgling or rattling noise caused by the buildup of secretions in the throat as the patient loses the ability to clear them. Signs that someone is near death: shortness of breath, isolation and drifting away, decreased appetite and thirst, nausea or vomiting, anxiety, constipation, fatigue, incontinence, skin changes, um, delirium, the death rattle, and pain. What color might a patient's urine be if they are experiencing kidney failure during the end of life? A, bright yellow. B, bright red. C, pale or clear. D, dark amber or tea colored. What color might a patient's urine be if they are experiencing kidney failure during the end of life care? Drop your answers in the chat and let me know what you think it is. If you are just now joining, welcome. My name is Phyllis, and we are talking about end of life with hospice patients. All right, I see a lot of D's. Let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Dark amber or tea-colored urine can indicate kidney failure, a common organ failure during the dying process. In end-of-life care, which symptom management is most appropriate for the patient with a death rattle? A, antibiotics. B, suctioning every 5 minutes. Every 5 minutes. Repositioning and medications to decrease secretions, or D, steroids. A, antibiotics. B, suctioning every 5 minutes. C, repositioning and medications to decrease secretions, or D, steroids. All right, I see some C's, D's, and B's. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Repositioning the patient and using medications that can reduce secretion and help to manage the death rattle. Frequent suctioning of a patient can be harmful because it can cause trauma in the airway lining, lead to hypoxia, low oxygen level. due to the removal of the air during suctioning, stimulate the vagus nerve, causing irregular heart rhythms and increase the risk of infection. What stool color might indicate liver failure in a patient receiving hospice care? A. Pale clay colored stools. B. Dark brown stools. C. Bright red stools. D. Yellow stools. Drop your answers in the chat and let me know what you think it is. A, B, C, or D? A, B, C, or D? A, B, C, or D? Drop your answers in the chat. Drop your answers in the chat and let me know what you think it is. All right, I see a lot of A's, see some C's and B's. Let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. Pale clay colored stools can indicate liver failure as the liver may not be processing bile properly. Which of the following is a common emotional response from families dealing with a loved one's death? A, denial. B, guilt. C, anger. D, all of the above. Which of the following is a common emotional response for families dealing with a loved one's death? A, B, C, or D? A, B, C, or D? All right, let's go ahead and dive right into the answer. I see a lot of D's. Let's see. If you chose D, you are absolutely correct. Families may experience a range of emotions, including denial, guilt, and anger, as a part of the grieving process. In end of life care, why is it important to maintain skin integrity? A, to prevent scarring. B, to prepare the body for postpartum care. C, to prevent the skin from drying. D, to reduce infection risk and maintain comfort. Drop your answer in the chat. Drop your answer in the chat and let me know what you think it is. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose answer D, you are absolutely correct. Maintaining skin in the integrity helps prevent infections and pressure ulcers, providing comfort to the patient. If you are just now joining, we are talking about end of life with hospice patients. Welcome, 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 everybody. If you need to go back at the end of the session, you can go back and watch everything over again. What is the appropriate CNA action when a patient's family asks about signs of impending death? A, ignore the question. B, redirect them to the nurse. C, explain common signs of dying process in a compassionate manner. D, change the subject. Drop your answers in the chat. Drop your answers in the chat. A, B, C, or D. All right, I see some B's. See a C. All right. Anybody ready to eat on Thursday? Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. It is important to provide compassionate and honest information to the family to help them prepare for the death of their loved one. When providing postpartum care, which steps should be taken first? A. Remove all tubes and catheters. B. Close the eyes and mouth of the deceased. C. Wash the body and remove any soiled linens. Place identification tags on the body. When providing postmortem care, which step should be taken first? A, B, C, or D? All right, I see a lot of D's. All right, let's dive right into the answer. If you chose B, you are absolutely correct. The eyes and mouth should be closed as soon as possible after death, as they can become more difficult to close as rigor mortis sets in. A CNA notices a terminally ill patient is becoming more restless and agitated. What should the CNA do first? A. Apply restraints. B. Call the family. C. Notify the nurse. D. Turn the patient every 2 hours. Drop your answers in the chat. Drop your answers in the chat. Drop your answers in the chat. All right, I see a lot of C's. Let's dive into the answer and see. If you chose C, you are absolutely correct. Restlessness or agitation could be a sign of discomfort or unresolved needs, and the nurse should be notified for further assessment. Which of the following is a typical sign of the final stages of organ failure in a hospice patient? A. Increased appetite. B. Unlabored breathing. C. High energy levels. D. Decreased urine output. Which of the following is a typical sign of the final stages of organ failure in a hospice patient? A, B, C, or D? A, B, C, or D? Drop your answers in the chat. A, B, C, or D? I see some A's. I see some D's. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Decreased urine output is a common sign of organ failure as the body systems begins to shut down. What is the best position to place a patient in when they are experiencing the death rattle? A. Supine with a pillow. B. Prone. C. Semi-Fowler's position. D. Trendelenburg. Trendelenburg. A, B, C, or D? A, B, C, or D? Drop your answers in the chat. All right, I see some B's, A's, C's all over now with the alphabet. Let's go ahead and see what the answer is. If you chose C, you are absolutely correct. Placing the patient in a semi-phallus position helps to drain secretions and makes breathing more comfortable. A CNA is helping a hospice patient with personal care. What should the CNA focus on? A. Keeping the patient's skin dry. B. Completing tasks quickly. C. Avoiding talking to the patient. D. Limiting movement. Drop your answers in the chat and let me know what you think it is. A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. Keeping the patient's skin dry helps prevent skin breakdown, which is especially important in hospice care for comfort. When caring for a dying patient, which of the following should CNAs avoid? A, holding the patient's hand. B, giving the patient something to eat. C, asking about the patient's spiritual needs. D, forcing the patient to eat or drink. Drop your answers in the chat. A, B, C, or D. A, B, C, or D. Drop your answers in the chat. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Patients at the end of life often lose the desire to eat or drink, and it is important to respect their wishes rather than force food or fluids. What is the significance of modeling of the skin in hospice care? A, sign of fever. B, sign of organ failure or poor circulation. C, sign of infection. D, sign of good circulation. Drop your answers in the chat. A, B, C, or D. Which is the significance of modeling of the skin in hospice patients? A, B, C, or D. All right, I see a lot of B's. Let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Modeling blotchy, purplish skin is a common sign of circulatory failure and can indicate that death is approaching. Which of the following best describes anticipatory grief? I think I said that correctly. A, grief after the loss of a loved one. B, grief that never does away. C, the process of healing from grief. D, grief experienced while the loved one is still alive. Drop your answers in the chat. Drop your answers in the chat and let me know what you think the answer is. Which of the following best describes anticipatory grief? A, B, C, or D? All right, I see some C's, I see some D's. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Anticipatory grief is the grief experience before the actual loss, as family and loved ones prepare emotionally for the death. In postmortem care, what should be done with the patient's personal belongings? A, they should be sent with the body. B, they should be left in the room. C, they should be returned to the family. D, they should be given to the next patient. Drop your answer in the chat. Drop your answer in the chat. If you chose answer C, you are absolutely correct. The patient's personal belongings should be returned to the family to respect their wishes and the patient's dignity. All right. Which of the following is true about hospice patients and pain management? A, pain management is not important in hospice. B, pain medication should only be given when the patient is visibly in pain. C, pain medication should be withheld if they cause drowsiness. D, pain management is a priority to maintain comfort and quality of life. Drop your answers in the chat. I see a lot of D's. All right, let's go ahead and dive right into the answer. If you chose answer D, you are absolutely correct. Pain management is a priority in hospice care to ensure the patient's comfort and improve their quality of life. When a patient receiving hospice care becomes unresponsive, the CNA should A, leave the room and return later, B, speak softly and continue to provide care, C, stop providing care, D, move the patient to a different bed. When a patient receiving hospice care becomes unresponsive, the CNA should A, B, C, or D. Drop your answers in the chat. A, B, C, or D. If you chose B, you are absolutely correct. Even when unresponsive patients may still be able to hear and feel, so it is important to speak softly and continue to provide gentle care. What is an appropriate intervention for dry lips in a hospice patient? A, offer water every 5 minutes. B, apply a thin layer of lip balm. C, place a cold cloth on the lips. D, use a toothbrush to scrub the lips. What is an appropriate intervention for dry lips in a hospice patient? A, B, C, or D? All right, I see a lot of B's. All right, let's go ahead and dive right into the answer. If you chose answer B, you are absolutely correct. Applying a thin layer of lip balm helps keep the lips moist and prevents discomfort from dryness. During post-mortem care, which step is important for infection prevention? A. Wash hands and wear gloves. B. Use antiseptic wipes on the body. C. Place the body in a plastic bag. D. Wear a mask and gown. Drop your answers in the chat and let me know what you think it is. I see some C's, B, see some A or B. Drop your answers in the chat and let me know what you think it is. All right, let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. Washing hands and wearing gloves is the most important step to prevent infection during postpartum care. Mortem care, mortem care. How can CNAs support themselves when experiencing emotional stress from caring for dying patients? A. Ignore their feelings. B. Work longer hours. C. Avoid caring for patients in the future. D. Seek support from colleagues or counseling. How can CNAs support themselves when experiencing emotional stress from caring for a dying patient? A, B, C, or D? A, B, C, or D? I see a lot of D's. Let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. It is important for CNAs to seek support from colleagues, supervisors, or professional counseling to manage the emotional toll of end-of-life care. Which of the following best describes palliative care? A, it is only for patients who are actively dying. B, it focuses solely on pain relief. C, it provides symptom management and improvement quality of life. D, it is the same as hospice care. A, B, C, or D? A, B, C, or D? Drop your answers in the chat. Drop your answers in the chat and let me know what you think it is. A, B, C, or D? I see a lot of C's. Let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Palliative care focuses on managing symptoms and improving the quality of life for patients with serious illness and can be provided alongside curative treatment. Curative treatment, unlike hospice care, which focuses solely on end-of-life care. All right, you guys, compassionate caregivers matter. Please comment, like, share, subscribe. Once again, my name is Phyllis. Thank you so much for joining me tonight. You guys have a blessed and happy Thanksgiving from wherever you're from and whatever you're doing. If you're traveling, please travel safely and catch me next week. So be on the lookout. For next week again. Once again, you can always go back and rewatch this same video if you need any more practice. I really want to do it. Good luck tomorrow on your written test. Yes, happy Thanksgiving. You guys, don't eat too much. Don't eat too much. I know it's the holidays and this is the biggest time we all eat, but try not to eat too much. Stay away from the sweet potato pies and pumpkin pies and cakes. All right, you guys, please don't forget to comment, like, share, and subscribe. Once again, my name is Phyllis, and be on the lookout for me next week at www.floridatraining.com. You guys have a good rest of your night. Good night.